So this should be, most of it should be according to your checklist. There might be a few minor tweaks, but it will be very, very similar. Okay. All right, so hand hygiene. Hi, Mrs. Smith. My name is Ashley. I'm going to be your nurse today. I'm going to change your dressing just because it is time to change that dressing, and it's actually looking like it's coming off. So I'm going to change that dressing for you today. So when you come in, you're going to have your central line dressing change tray, your bio patch. You all may not have a bio patch for your checkoff, so if you don't, that's okay. I'm going to show you with the bio patch, and if you don't have it, don't worry about it, okay? So we have the dressing change tray, the bio patch, and then we also need, I'm going to have my own special pair of sterile gloves. There should be sterile gloves in your kit though. I'm just allergic to latex. Okay, I'm just gonna get my stuff ready here, if that's okay with you. So just hang tight here. So you're going to want to, just gonna extend. There we go. You're gonna wanna wipe down the surface that you're going to do the sterile procedure on first with an antiseptic wipe. Hand hygiene after that. I'm gonna put on clean gloves now for removal. So my clean gloves are on. I'm going to then take this off. Great, that's a different dressing. Okay. So I take that old dressing off, I dispose of that, I take those gloves off, and I'm gonna do hand hygiene, okay? So in your kits, when you open these up, your very first thing you should see is a mask. So you're going to want to place this mask on yourself, and if you're patient, well, you could just put a mask on the patient too. Okay.
We already have one, like, we wear masks and.
Yeah, that's true. So you could give this one to the patient.
So we wouldn't have to change it though?
Nope,
Okay.
You don't have to change it as long as you have a mask on, because you just don't want to be breathing on it, basically. Okay, so in here are your sterile gloves. So you can pull those out without contaminating the stuff beneath, and put those on. So I'm gonna put my sterile gloves on here. But you can get the sterile gloves out and the mask out with clean hands. That's okay. All right. All right, so now I'm gonna bring this closer to me here. You do not need any of this stuff, so you can just grab that out. Okay, we are gonna use the simulated swab sticks in here. And we are gonna pretend that this is chlorhexidine, because almost all of your kits are gonna have chlorhexidine. So what you're gonna do, that it comes in an applicator that you're gonna break on both sides. Have you guys seen that? Where it's like two little buttons on each side. You press it and it breaks, okay? So that's what you're gonna just pretend that this is chlorhexidine. And you're gonna scrub in one direction, make sure you get over the lumens and everything like that, and then you're gonna scrub in the opposite direction.
With the new stick? Or that same
stick? It's the same applicator, it's just one thing, yep. And so we're gonna pretend like it's chlorhexidine, because honestly, that's almost all your places are gonna have chlorhexidine for their, nobody's gonna have alcohol in there. So you're gonna scrub in one direction, scrub in the opposite direction. When you're doing this, if you were to by chance contaminate your hands at all, you could just change your sterile gloves. So just, if you do that in your checkoff, just say, oh, I contaminated, I would change my sterile gloves. Yes?
If we're supposed to be cleaning the lumen, is it okay if we grab the bottom, do that, and then change sterile gloves if we're supposed to clean that?
If you touch the lumen with your hands, yes, you would need to change sterile gloves. In some of them, which it's not in here, but a lot of them will have forceps that you could take with your sterile gloves, grab it with the forceps, and then kind of maneuver it that way so that you don't have to contaminate your sterile hand. But it doesn't look like your kit has that. But if it is in your kit, you could use those
Okay.
forceps.
If we break sterile field, is it going, like, are we gonna fail?
No,
No.
just
I
say,
mean, like, in our simulation, like,
in your simulation, if you break sterile technique, just say, I broke sterile technique, I'm gonna go get a new kit, start over. Because in real life, here's the thing, you're never gonna be perfect sterile field wise. You just need to know when you break it and need to know how to fix it. Yes.
So, when you're cleaning it, don't you need to hold it somewhere so it doesn't slip a little?
Most of them will be sutured in,
Okay.
so there will not be a whole lot of movement.
Mine wasn't, that's why I was like, she always had to hold it and it.
Okay, so if like for a pick, was it a pick? So if you are changing picks, then yes, you would probably have to use those forceps to hold them down. Or if you're holding it down with your one hand, you can't use that hand anymore. Yep. But that's good thinking to think about, okay, if I touch that person, I can't use that hand anymore to be getting my sterile stuff.
Does this apply to a midline or is it different?
That's different. Yeah, it's,
Because I was like thinking, I helped my nurse with the midline, and I was like, that's not what she did, but it's different.
yeah, it's actually a peripheral line, it's not a central line. Okay, so with these transparent dressings, what you're gonna do is you're gonna peel off the back first, which is the clear piece. We wanna make sure this is dry. Oh, our bio patch. Didn't do the bio patch. All right, I'm gonna have my assistant, come here. Can you drop that bio patch into that? Nope, take it, open it up, and then just kind of drop it in like without touching it. Perfect. Perfect. So a lot of times your bio patches will be in your kits. They won't be separate, but, and I don't even know if you guys are gonna do it with the bio patch, but I'll show you that. Okay, so your bio patch goes on. And when you place your bio patch, you wanna make sure that when you put it on, that you have it in line with the tubing. The slit is in line with the tubing so that when you remove the dressing, it doesn't pull your line out, okay? So you don't want it turned and flipped so that when you pull it, it's hard to get off, okay? So that's, and you want the blue side facing you. All right, so my backing is off, my bio patch is on. Gonna put my transparent dressing over that side.
at this point, since you're putting this on, you can smooth it out and not
Correct.
worry about
Yep,
making
no more sterile technique because now my insertion site is covered.
Okay.
So we're gonna have that. And then the blue is the last thing that you pull off on each side. Time, date, and initials go on the dressing. And another thing that your kits don't have that maybe your kits in the hospital will have is skin prep, which helps it stay sticky. So I can't stress enough, if you have skin prep, to use it, because especially if you're in the IJ region, your patient's all sweaty, the hair, just, it's easier to keep it attached if you use the skin prep.